Today our topic of discussion is Widal Test, which is also known as Typhoid Test. What we will see in this video, first of all we will see introduction, then indication, then procedure, then interpretation. Widal Test, it is the diagnostic test of the typhoid disease. It is based on the principle of agglutination. It is basically a tube agglutination test. It should be performed in second week of illness of typhoid. In Widal test, we detect the antibodies present in blood serum of the patient by using surface antigen of Salmonella bacteria. Now we will see procedure of Widal test. In Widal test, the requirement are a serum sample of patient and a test tube containing surface antigen of Salmonella typhi. The surface antigen used here are Salmonella typhi O antigen, Salmonella typhi H antigen, Salmonella paratyphi A H antigen, Salmonella paratyphi B H antigen, Salmonella paratyphi C H antigen. There are total 5 categories of test tube, each category containing different titer values as 1:20, 1:40, 1:80 likewise. Then we carried out serial dilution of the test tube containing this antigen with the serum sample of the patient and incubate the test tube for 24 hours at 27 degrees Celsius temperature, and after this we observe for the agglutination and interpret the result from this. If O antibodies are present into the serum of patient, then it will produce granular chalky clump when react with O antigen of the Salmonella. When H antibodies are present, it produces cottony woolly clump when it reacts with H antigen of the Salmonella. After 24 hours of incubation, if clump or agglutination occur in test tube, it represents positive result, and if test tube is clear with no agglutination, then it show negative result. Now we will see two Widal test report, one with positive test and another with negative test. So this is the Widal test report of the typhoid positive patient. In this report, on left side there is a column representing the antigen of the Salmonella typhi, and in upper side there is a row showing different titer values as 1:20, 1:40, 1:80, 1:160, 1:320, 1:640. We carried out different titer values dilution and see for the result. So the titer value 1:20, 1:40, 1:80 and 1:160, these are positive for the Salmonella typhi O antigen and Salmonella typhi H antigen. Now if you will ask how do we interpret whether the result is positive or negative, then the titer value 1:20, 1:40, 1:80, these are less important, don't hold any importance for the interpretation. But if the titer value greater than 1:160 or greater, if they are positive, they represent the positive Widal test. So in this report, the titer value 1:160 is positive for the Salmonella typhi O antigen and Salmonella typhi H antigen. One thing we should keep in mind, if titer value for the O antigen, that is if O antibodies are present into the serum, it show active infection, and if antibodies against H antigen of the Salmonella are present, it shows past infection or immunity or recovery. Now we will see another report. This is the report. In this report the titer is carried out, and titer value 1:20, 1:40 and 1:80 are positive for Salmonella typhi O antigen and Salmonella typhi H antigen, while it is negative for 1:60 and above. So if titer value 1:80 or less than it is positive or negative, it don't hold any importance for the interpretation. If above the 1:80 it is negative, so the report is negative. So this report comes to be negative. So this is all about Widal test. Thank you.